Hey guys. Um, Today should be like a happier day, I guess, but at the same time I'm really nervous. I made an appointment with a doctor in Maryland. Bought plane tickets, car rental, all of it. And we have a place to stay while we're up there. I'm looking forward to meeting this doctor. I've heard really great things, and I'm terrified of, what the treatment protocol is going to be. I know that I'm going to have to change the way that I eat tremendously. I know that a lot of Lyme patients are strictly forbidden for sugar, yeast, I want to say gluten-free, wheat-free, dairy-free. So it's going to be hard. But I think I can do it. I just, I want to get better because I want to have children. And I am 30 and I don't have too much more time before, before I'm ready to give up on that dream, I guess. I promised I'd do an update, but it's a little bit past midnight, so technically it's not an update for yesterday. I went to see my dad today and brought him a sleep study test from the doctor's office, and we had pad thai, and it'll probably be the last time I have pad thai for a long time. Even though I love it, it's just going to be something that I'm going to have to either figure out how to make it to where no symptoms flare, or just not consume it at all. From what I understand is that if I don't respond well to antibiotics orally, what happens next is I get a PICC line placed, and I get at home through a home health agency an RN to place the PICC line, and then I get IV antibiotics, I believe vitamin C doses, B12 injections, just probiotics, immune system boosting type things, because apparently that this is what's going to happen is my immune system's going to get completely wiped out. In order to kill the bad cells, they have to kill the good cells too. I'm hoping that there's like a test for the heavy metals in my blood, because I know that could attribute a lot to my sleepiness and how exhausted I am. But I'm nervous because I feel like Lyme is going to just kick my ass. The last 4 years have been terrible with being sick. However, this last year has gotten to be the worst year so far. Having memory issues. I'm still trying to be independent as much as possible, but my dad thinks that I need to get a walker because I'm so imbalanced and so unsteady that I fall quite a bit. I almost fell today. several times actually, and was able to catch myself, but one of these times I'm gonna miss, and that's not gonna be good. I have, let's see, so here's what the kind of breakdown is for the monetary stuff, because I haven't really talked too much about it because I didn't know exactly what I was going to do. Well, so the plane tickets to go up there, and both Cameron and I wanted to attend at least the first meeting with the doctor, just so that we are all on the same page, and I have someone to hold me accountable for getting better, because this is what I want. So that was like $500, $515. Our rental car was $200 for the amount of time that we'll be there. Our lodging is free thanks to Kelly. She's being absolutely amazing and sharing her home with us so that we don't have to fork out any extra funds for hotel. The initial appointment is $825, and that includes the consultation, to see, how far out I am, and then there's also a blood smear test as well. And I want to get that taken care of. And then after that, subsequent appointments are going to be $275 because he does not accept insurance, as do a lot of Lyme doctors. And then the protocol is that once I'm finished there, I can come back home and I can have a home health agency come here to where I live and hook me up to the PICC line and, administer the medications and things like that. And the doctor is willing to Skype with me once a month, I believe it is, depending on the treatment plan. It could be less often, more often, not sure. I'm extremely nervous because some antibiotics like vancomycin, they really, really just make my stomach hurt horribly, and so I'm definitely going to be taking the probiotics. I was thinking about doing the hyperbaric oxygen chamber, as well as doing a floating session to see if any of that would help as well. That won't be till later on because we definitely don't have the money to do that right now. I'm just kind of desperate in the fact that, we don't have the money to deal with Lyme, and I would never wish this on anyone, to have to deal with, Lyme disease and even just the worry of Lyme disease. I getting tested and finding out that I had Lyme, I thought it would be a huge relief to find out what was wrong with me. But in fact, it was quite the opposite. Like, yes, sure, I'm happy I know what's wrong, but I'm at the point where I wake up and I don't want to get out of bed sometimes, and I kind of have to push forward because we have puppies, and I have to eat breakfast, and I have to take medication, and sometimes I can't physically get out of bed. And then halfway through the day, I'm exhausted. Like, it's like I ran a 5K or something, like that kind of fatigue. I've run several before, and I felt similar after them. And I barely did anything, Like, today is, I mean, I did a lot today, so I'm really exhausted, but I could have done more, probably, and it hurts to think about how much pain that causes. I am on a great new drug, though, that I recommend if your insurance covers it. I was prescribed Marinol, and that twice a day little pill is like, you don't get high or anything from it, which is pretty amazing because that's not what I'm looking for. But it's like a huge relief, like that brings the pain level down much more manageable. Instead of like 8, 9, 7 sometimes, I'm looking more like a 6, 7, sometimes 8 with Marinol, which is, you have no idea how much a 3-point difference is. Sometimes it's life or death. I didn't actually want to do these videos because I'm embarrassed about myself, and how people would react to, this. When doctors react to Lyme disease, they roll their eyes, and I can't see what the internet does or doesn't do, and I'm highly sensitive, and I'm sure that has to do with hormones and thyroid issues and such things, but like, I was terrified to put myself out there, and hopefully one day it just becomes like easy and not horrible in any way. Like, I can just get there, get on, give the information, and then, stop it, and that be the end of it. Journals, I guess the fact that I have to keep a journal every day is kind of difficult, because I don't always want to write, and I don't always want to talk about how I'm feeling. There was a night a few months ago, like 2 or 3 months ago, I think, where I was in so much pain that I called my dad crying, and I was laying on the floor, and the way I explained the pain to him is that you could rip my spinal cord out, use it as a whip, and set people on fire just by touching them, because it hurt that badly. Like, I felt like my back was in flames. And this is the thing that scares me the most, is I go to the emergency room because I've never felt pain like that in my entire life. And the doctor was like, well, there's nothing that can make your pain make you feel like that. And I was flabbergasted, because I'm like, how do you know? And of course, the minute I mentioned fibromyalgia or Lyme disease or anything, his eyes just glazed over, and he rolled them at me and was just kind of like, basically, pee in this cup, to see if you have like a kidney infection or something, and then we're gonna bring you to the street, which is, it's whatever. But I did. I peed in the cup, and the cup never left the room. And then he came back and told me I had a UTI, which is kind of impossible because the cup never left the room. No one touched the cup. And it just pisses me off how they can do that and get away with it. It's, the healthcare system is so frustrating to me. The fact that my insurance isn't going to help me get better is the worst part about it. Like, with insurance, if I had cancer, I would get chemotherapy and radiation as long as it takes. if I had AIDS or HIV, I would get therapy and medication and counseling and all kinds of things, psychiatry, without question from my insurance company. But with Lyme, you don't get anything. Within the first, 48 hours, if you don't see that tick within the first 48 hours, and you come up with a diagnosis later on, you don't get anything. You don't get to see a doctor that accepts your insurance. And also I want to mention that even though people get that 30 days of antibiotics or 28 days of doxycycline, some people don't get better. I mean, some do, granted, but some people don't get better. I want to get better, and I think that this is my best option, is going to Maryland and seeing this doctor and hoping that everything comes out as it should. I'm sorry, I keep saying a lot. I'm losing my train of thought, and I'm trying so hard to just keep it together. Did it again. I just want to say thank you for all of the donations thus far, and for all the people that are sharing it, my video and my campaign, and everything is a huge blessing to me. I love the fact that you guys care so much, and I mean, even if you can't care monetarily, which, that's fine. If, you share it and you learned something from my video, or even it sparks, curiosity on Lyme and how it was developed, and, other tick-borne illnesses, which are just as horrible as Lyme disease. If it helps get you there, then I've done my job. I don't want to die from this, but as long as someone gets, the help that they need, or, if you're chronic fatigue, you should get tested for Lyme. If you have fibromyalgia, you should get tested for Lyme. The initial test for the antibodies is not as expensive as the ELISA test or the Western blot, which is hardly ever comes up accurate anyway. And honestly, if you've got the antibodies, they're there for some reason. So find out what that reason is. You got bit at some point, and you may not remember it. You may not remember the bullseye rash if you had one. I didn't remember the rash. I got bit when I was a kid. But just try and remember that you're not alone. There are groups out there, support groups, and everything, and just kind of keep pushing forward, and don't take no for an answer. If someone, the minute, like I heard a quote, and I don't know, if it's their quote or if they heard someone else say it, so I don't know who it actually was that said it, but when you have a problem and the doctor stops having faith in your problem, like you mentioned Lyme disease, and they roll their eyes, it's time for a new doctor. You just have to bite the bullet and fire that doctor and move on, because the minute that they stop believing you is the minute that you're going to be treated like crap in the office, and you don't want that. I'm really glad that I'm going to be having Cameron come with me to Maryland, because I feel, and this is a stereotypical, um, a stereotypical thing to say about women, but I feel like women get treated differently in doctor's office visits and in ER visits. Like, I definitely get treated differently when Cameron's there versus when Cameron isn't there. And it's so sucky that I have to feel needy like that to him. But I really am thankful that he is in my life and that he cares so much about me. Anyway, I'm going to go to bed. I'm signing off for tonight. Journal entry number 2 completed. Bye.